Brandon's an active man and father from Nebraska.
I'm 28 years old. I'm a paramedic, and I do that part-time, and I have a full-time construction company. We do some residential remodels and some light commercial work.
As a paramedic, Brandon injured his back while performing an emergency extraction of a person at the scene of a serious car wreck.
At that point, I definitely felt I did something to my back. The back pain impacted my life in every way. I was off work for about 8 months. I couldn't sleep. I probably functioned on like a 20 or 30% level. I wouldn't pick up my children. I wouldn't be able to bend over and tie my shoes very well. Everything took a lot of time getting out of bed. Getting dressed for the last 2 years has been very difficult.
Brandon tried numerous conservative treatments, but nothing helped.
So I have degenerative discs and then bulge discs and an extruded disc. And basically they sent me to physical therapy. I did chiropractic care. They put me on a bunch of pain meds. Basically the neurologist just said we should just do surgery and fuse 3 levels. Being as young as I am, the idea of fusion was not something I wanted to follow through with, just because I knew that as soon as you have a fusion, you're going to have to start adding fusions on either level just because of the damage that's going to cause to each one. And so my wife started looking on the internet, and then I started watching YouTube videos, doing some research, and then decided that this was a very good option, especially being it's so minimally invasive. And the quicker recovery time. As soon as my wife found Bonati Spine Institute, she sent me a link, and I opened it up, filled out the little questionnaire. I had a call within like 15 minutes.
After sending in his MRI for review, Dr. Bonati called him personally to say he was a good candidate for the exclusive Bonati Spine procedures.
He reviewed my MRIs that I had originally and was able to tell me where my pain was from that. It was a very big relief to be able to realize that, hey, maybe there's a path that I can go forward and I can actually live and do things.
Upon arriving at the Bonati Spine Institute, Brandon received a physical examination and updated his MRIs at the on-campus imaging center. Just minutes later, Dr. Bonati reviewed his new imagery with him and outlined a customized surgical plan to eliminate his pain.
It was a lot better of an experience than the last MRIs that I've been in. And then you come back in and they've already reviewed your MRIs. They go through your MRIs with you. The doctor comes in and they pull it up on a large screen. They show everything. They pinpoint exactly what's going on and show you where, and then talk you through the plan, the treatment plan.
The targeted Bonati spine procedures are performed incrementally using conscious IV sedation, where the surgical guest remains awake and communicating with their surgeon to ensure their pain is eliminated before they leave the operating table.
They would ask me, does this hurt? Can you move this? Can you move this leg? Does this hurt if you move this leg? They asked me to do like a modified push-up, which I haven't been able to do for like 2 years.
Back pain should be totally gone.
Okay, so just like a straight push-up or for...
Yeah, push-up. All the way up, higher, higher. Then
now arch your back like that.
Arch your back, so a half push-up.
No back pain?
Oh, no back pain at all.
All right, good. Down.
I think the surgery is amazing, and being awake for part of it, the idea is really amazing. I don't think anybody should be scared to go through that process. You feel a little discomfort, but you don't really care. It's not that bad. It's not significant. It's not like the pain you deal with every day. You'll feel movement, but it's a really neat process.
Brandon, like many surgical guests of the Bonati Spine Institute, was surprised at just how quickly he was able to be up and walking in the recovery room pain-free.
I noticed I could feel my left foot again, and it felt like I had a new foot because I hadn't really felt my foot for 2 years. I would definitely recommend the Bonati Spine Institute to anybody who, before you go put hardware in your back, try this, because it is way better. At the Bonati Spine Institute, when I'm done with the surgery, I can walk out and there's no brace, there's no special physical therapy other than walking around and your normal daily life light. I look forward to getting back to work and being able to hang drywall and move trusses and being able to roll in jiu-jitsu and get back on the mats. I'm really looking forward to that, being able to pick up my children without my foot going numb and my back hurting a lot.
To see more stories of recovery just like this, search for the Bonati Spine Institute on YouTube, Rumble, Apple's App Store, Google's Play Store, Roku, and Amazon's Fire TV.